Meet John, a nurse who experiences gender discrimination in the workplace.
Males are often identified as male nurses, whereas a female nurse is rarely identified as a female nurse. This can lead to the assumption about male nurses that they may portray the idea that the man is not masculine because of his choice of career, or that they are not as compassionate or nurturing as a female.
During the Victorian era, women in the middle class had limited access to employment. Activism arose among them to establish employment. Their voices were heard, which led to nursing becoming a promised area of work. Throughout the 19th century, nursing was a field of work for respectable women and accepted as suitable outside of the home. Florence Nightingale being birthed from this era was a vital asset to shifting the public stance towards accepting women working in the nursing field. Since the mid-20th century, the need for gender balance and diversity has been identified. Nursing has evolved into an autonomous profession and has seen an increase in the number of men employed. It is clear that gender discrimination inhibits one from partaking in full human rights. According to the Code of Ethics, nurses must abstain from behaviors which could impose judgment, labeling, humiliation, or stigmatization towards patients receiving care. Along with this, the Canadian Nurses Association has taken a stance on removing the she bias from their standards of practice and code of ethics in order to embrace both men and women in health practices.
Society's stereotypic beliefs concerning gender qualities allude to female characteristics as nurturing, altruism, and empathy versus male traits as independence, power, and ambition.
The paradox of men in nursing has become quite evident. On one hand, John experiences being the minority in the profession, yet he climbs the ranks in education, management, and clinical roles in a less amount of time than females. However, he is still prone to experience rejection and burnout.
Considering all these facts, men still leave the profession at a higher rate than females. The Canadian society has become increasingly sensitive to the call for gender balance and diversity in culture, religious, and ethical matters. The traditional societal viewpoint that negates men taking on the nursing role is shifting. RNAO's Nurse Ambassador Program compels nurses to express their knowledge and experiences concerning the profession in schools and public events where the next generation of nurses resides.
Through a feminist analysis, the intention is to not privilege one gender over the other. Perhaps nurses should view their profession as a place to implement both their female and masculine characteristics, no matter the individual gender. This stance will then challenge the globally and traditionally adopted view of nursing as a female-dominant profession, ultimately shifting the societal norms. The public tend not to grasp the exponential cost and excessive waste of resources that are attributed when a nurse leaves their position in the field. It costs a hospital anywhere between $25,000 and $60,000 when a nurse leaves their position.
By eliminating the stigma behind the gender nature of nursing, the exclusion of men will decrease, leading to a more stable and empowering healthcare system. Some of the barriers that exist in the nursing profession are the lack of discussion in the nurse's nature of work, the effects of power and gender in the nurse's work and knowledge, the biased attributes of female nurses, as well as the gender of nursing in which society portrays what has been historically constructed of what a nurse and their role encompasses. The lack of discussion in a nurse's nature of work, there needs to be more information and communication of what a nurse's role is, rather than identifying the role based on gender and gender-related characteristics.
The decrease of transparency related to the gendered nature of nursing leads to our lack of ability to really question the assumptions tied to this issue.
These characteristics of stereotypes surrounding the gender role of nursing can be referred to as gender bias and contribute to the idea of nursing being a primarily feminine profession.
The gender nature of nursing has been constructed on what society has believed over time, which has been long ingrained for years. It's only been in recent years that nursing programs are available to both genders. Between 2006 and 2015, men practicing in the field has increased by 2%.
In order to devise strategies for resolution to the barriers that exist in the gender and nursing roles, we must first start at a personal level if we want to change what society as a whole believes. Changing the terminology of how we refer to nurses, such as eliminating the term male nurse and replacing this as nurse, regardless of sexual identification, would be the first step.
The identities of nurses, such as gender, sexual orientation, class, ethnicity, as well as the differences between genders viewed by the world, must be acknowledged in order for any positive changes to occur.
Shifting the view at an educational level is imperative. Professors should support these changes by reviewing policies and procedures, ensuring that gender bias are not identifying factors. Instead, individual attributes of nursing are put into professional practice.
John can continue to actively advocate in his field to see a positive shift within the nursing profession.